Thank you for joining us this evening on Health Digest. And if you're just joining in today or tonight, we are discussing about postpartum depression. We are discussing about the issues around depression before, during, and after delivery that affects many mothers. It even affects how they take care of themselves, or they take care of their baby, or they take care of everyone else in the household that they're supposed to. And with me in studio are two mothers who've gone through postpartum depression, and Dr. Catherine Siengo, who's a psychiatrist. The two mothers are Samoina Wangoi and Purity Kendi. And to kick off this second part of Health Digest, I'd like just to find out from the two of you, how did you cope with that situation? You are at a point where you don't know exactly what's happening, but you know you're really not in a good place. How did you cope with this?
Let me backtrack to the place where I slapped my son. So when I slapped him, I knew now there's a problem. Like there's a very, very big problem and I need it addressed. But I was still jobless. So I went on to Google and then I typed my symptoms. I typed the anger, the irritability, the suicidal thoughts, the intrusive thoughts, all that. Then at the end, I typed, why do I hate my baby so much? So then the search results came up and they're all pointing to the likelihood of postpartum depression. So I then Googled, so what's the treatment? What are the options for postpartum depression if someone is suffering? And of course, there was therapy. There are quite a few solutions. There was option of support groups. If it's mild, there was therapy and something else for postpartum psychosis. But there was a catch. I didn't have money, so I couldn't go for therapy. And therapy in Kenya is a bit on the higher side. So I decided to start writing down my experiences. Initially, I started with a journal, so I'd write pages and pages and pages and pages of what I'm feeling, of what I'm thinking, no matter how horrible it was. Then my sister and her friend urged me to start a website to share my experiences on that, so that if there's anyone who's struggling, then they'll know they're not alone. So I started on the blog, and the initial approach I took when I started on the blog was, I will not sugarcoat it. If I'm not able to bond with my baby, that's exactly what I'll write. I'll write, I'm not able to bond with my baby. He is annoying me. I'm very, very irritable. I hate to hear him crying. So I wrote all that. I'd share very, very vulnerably, I must admit, and very candidly. I wrote everything I felt, the struggles. Some days we'd wake up and I didn't feel like I wanted to be a mother. Sometimes I felt like I wasn't a good enough mother. So I wrote all of it down. And then somewhere down the line, I eventually managed to go for therapy, and now that ushered me into my recovery journey. So that's how I coped.
So it's more of a self-prescribed coping mechanism and recovery, and I'm sure Dr. Ria will be telling us how talking about it helps. Kendi, how did you cope with that situation?
Before I reached out, for me, when I spanked my son, you know, there's that feeling of guilt. He's such a small baby. Like, why are you hitting him? So I will go back. That's when I realized every time he cries, I'll feel so angry. So I started taking a breather. I would like leave him cry, just cry. Nothing will happen to you. I go out, I'll go breathe in so deeply. Then I'll come back when I'm not feeling so angry. Then I'll pick him up. So, and then I introduced, I would always tell my husband not to come with breakfast. So that at least I will go out for that 5 minutes walk, buy breakfast, then come back home. So for me, taking a breather and always taking a walk in the morning really helped me before reaching out to get to know other ways of coping, but those were my coping mechanisms. Yes. Okay.
Dr. Ari, how should women cope with this situation? We've heard from the two of them. She took upon writing, she took to walking and taking a breather. What other ways can women cope with postpartum depression?
Yes, I would say for their cases, they handled it. They had a lot of support because at least you had a mother and a sister to help you with the baby. You had a husband to hold the baby as you take a walk to go and buy things from the shop. So the first thing would be to call upon people who can help you, which they did very well, and also to find ways of coping with it. However, depending on the severity, the mild cases, you could be able to deal with the social support, talking about it, and finding meaning. You know, in life, you have to be able to find meaning in whatever you go through. That way, you will find a way of continuing to live, however hard the situation is. If it's moderate to severe, sometimes you will need structured therapy. You would need medication in some cases. And because pregnancy, when you're breastfeeding, there are some medications a breastfeeding mother will not take. When it's severe to the point where the mother even thinks of harming the baby, we will even resort to what we call ECT treatment, because the mother recovers faster. There are cases where you have to separate the mother from the child because she could be in danger of harming the baby. So I would say, depending on the severity, even the therapist would be able to tell you, I think this requires extra care. So the beginning would be to talk about it and list the social support, because it could be blues, which would, with support and care and encouragement from home, would go away. But if it's moderate to severe, then you'll need to seek therapy, and then the therapist would actually advise you, or even a doctor, that if this is this extent, then you may need medication or even hospitalization, because we have had cases of mothers who have actually ended up, unfortunately, killing the baby or attempting suicide. We don't want it to get there. Or mothers who have had no support and they just left the baby crying, and somebody happened to pass by and find the situation as it is. So we do not want it to get there. So it's good for them to seek help and be told, yes, yours can be managed with therapy alone. Yours might need extra, even sleep, anxiolytics to sleep, because sleep is very important, and a new baby sleeping will disorganize the sleeping patterns of the mother. Even a sleep aid, once a woman, a breastfeeding new mother, gets good sleep, then they'll be able to cope with some of those things. Yes.
And what of in a situation where the mother doesn't have good social support? It's a single mother where maybe there's no family or they're not nearby. How do they cope when they are just alone with the baby?
I would advise, go to the nearest hospital and explain what you feel, because a good hospital would actually be able to take you in with the baby, and even the nurses can also be able to help you with the baby. So I would say, go to the nearest hospital. You'll get assistance. Don't suffer alone. But our African society, you'll find a sister, a cousin, a mother, somewhere, a friend who would care. So it's good to combine all that. But if all is not working, please, you'd rather even walk with your baby to the nearest hospital and say, this is how I feel. The health care workers there would actually be able to see your situation, and they would rather even admit you with the baby, and at least the nurses can help you with the care. Yes.
Okay. I want to go back to something, Somaina, you had said about when you put in the search results and they told you this, and there were no support groups, or there were no people really that could say, I have gone through this, and there's already a system and a network of people going through this. Why is it difficult to talk about this situation?
I'd say because in our African society, you are supposed, and I use the word supposed in quotes, you are supposed to enjoy motherhood. So why are you not enjoying motherhood? In fact, some of the moms I've interacted with in the course of the work I do will tell me, you will be asked, why are you not enjoying motherhood? Some were told, you're not the first one to give birth, you're not the first one to deliver. Our mothers delivered 12 children, our mothers delivered twins, and they were not complaining. So why are you complaining? So I think when you hear that and you know you're genuinely struggling with maybe postpartum anxiety, like in Purity's case, then you decide, let me just shut up and, deal with it in my own way. But there's a lot of stigma associated with it. I think in part because it comes at a time when you are supposed to enjoy it, but for many moms, you don't enjoy it. Yeah.
Purity, from where you are and from what you've gone through and the people you've interacted with, why is there a stigma, and why is it difficult for women to talk about this?
People expect, as she has said, people expect women to be superwomen, where you're able to handle every thought, everything, and make sure that your house is in order, your baby, you're enjoying motherhood. So until people get to a place where they understand that being a mom, mostly being a first-time mom, is not just a natural thing. It's a process where a woman needs to go through until they get to that place where they're able to bond with their child. So people need to stop taking women as super women and assuming that every emotion is normal, and just keep reassuring them and giving them support. I think reassurance would really help. Telling a mother you're doing the right thing, you're able to do this. Can I help you in this? And also I think women need to reach out. Sometimes we assume we can do everything. The simple thing, hata kuondoa kikombe kwa meza. If you feel it's so difficult for you, ask for help. Kindly get this cup from the table if you feel you're not able to do so. So people asking for help is going to really help them like overcome and giving a lot of support. Yeah.
Dr. Why is the environment or the society stigmatizing what is basically a medical condition? It's like having a flu. Why is the society stigmatizing it?
Many people do not understand depression or any other psychological, emotional problem because you see, like if it's a physical pain, I would be able to see your swollen leg, I'll be able to I'll see you're in pain, but here you are, you look healthy, it was a normal delivery, like they say, you didn't go through a cesarean section, although even those who go through cesarean sections can also get postpartum depression, so they'll be saying, and I always tell people that do not judge somebody if you have not been in their shoes. So if I say I do not feel well, take my word as it is, I don't feel well. You might have delivered 3 babies and you enjoyed motherhood throughout, but here I am, I'm telling you, I am feeling sad. Take it as it is and assist me the way I am because we are all different. Even in a family, you could be 8 sisters and none of them has experienced what you're experiencing. So whenever people say, I feel sad or I feel overwhelmed or I'm anxious, don't just brush it off and say, we've been through it, you'll be fine, just do your best. Listen to them, link them up for help, because not everybody reacts to things the same way. Genetic composition of everybody is different and our circumstances are different and we interpret things different. I could lose a job, lose a husband, lose all those things and I don't get affected. And somebody else here, they are told your child has this problem and it breaks them down. So let's be sensitive to each other. If somebody says they are not feeling well, take it as it is and assist them. Don't just say because I did it and I'm fine, you will also be fine. Yes.
Okay. And from the two of you, Kendi and Samoina, has the environment changed or gotten any better in terms of accepting postpartum depression or postpartum anxiety, postpartum blues, just the general mood disorders around delivery? Has the environment changed and society changed from when you were diagnosed and up to now?
I wouldn't say it has really changed. This is the time when people are really speaking out about depression. So I'm thinking that there is much that needs to be done for people to, and for the society to get to a place where they're able to overcome the stigma. So I feel like the information needs to be really spread a lot for people to know, because maybe if I had not gone through it, I would be the person that judges that woman. So much needs to be done. Yeah.
From your case, Samoina, has the environment gotten any better? You've been in this journey for 6 years now. Has it gotten any better? Are people accepting? Are people embracing women who are going through these mood disorders? And of course, you've been interacting with many mothers who've been going through this. Is it changing or getting any better for them?
I'd say, like Purity says, we still have a long way to go, but I'm happy people are talking more about it, I'd say, especially with the advancement of social media in our Kenyan community. Many more moms are speaking about it. They might not, have the full information and the support systems and everything in place, but they're speaking about it, and that is good enough a start. But yes, we still have a long, long way to go. But I'm glad we even have this kind of show on TV, because maybe 10 years back, we probably wouldn't be having this conversation. But the fact that you're having it now, the fact that we are speaking about experiences, it means we're doing something about it. It's slow, but we've begun.
Okay. And now specifically, is there support? Dr. said, when all else fails, just walk into a health facility and say, this is what I'm feeling, and let the professionals, the healthcare professionals help. Do you feel or do you think there's that kind of support and help for mothers if they walked into a hospital to seek help from the healthcare providers?
My son is now 6 years, so admittedly I haven't been back there since. So I do know that the situation has changed. But at that time, when I was delivering in 2012, the doctor basically just asked me about the baby's heartbeat, baby's weight, baby's health, but they didn't ask me about, they asked me how I'm healing, because I had to get an episiotomy. So they asked me how I'm healing, and that was it. No one asked me about my mental condition, no one asked me about how I'm feeling, whether I'm enjoying motherhood. So I'd say for me it's lacking. But since it's been 6 years, I want to give myself a benefit.
I think Kendi was recently there, she can tell us.
I don't think, from where I went to hospital, I don't think it's better. Actually, I never went back. I was so angry at them because for me it was negligence that took me through that journey. I don't think it's better because after even going for the first 6 weeks injection, no one asked me how I'm doing, and I went through episiotomy. No one wanted to know if I'm healing well. So I have to go to my Google, like find out I'm feeling this way. Is this normal, you know? So I'm not sure it's doing better. There's a huge gap between the healthcare providers and the mothers that are going there for the services. So I wish they can improve.
Dr. Mothers are having to resort to Dr. Google when we have healthcare providers. Why is this?
For my case, I would say the ones who have landed in hospitals, like psychiatric hospitals, which again are stigmatized, and a mother who has a small baby does not see why they should seek help in a psychiatric hospital. But I've seen in my practice several referred from KNH to Mathare Hospital. Unfortunately, those are the severe cases, and normally would have to organize for the baby to be taken care. There are some desperate situations where we've had to take the baby to a shelter for the baby to be taken care until the mother is well. Those were very severe cases. I know private psychiatric hospitals which would allow you to come in with your baby. I've seen mothers who have gone into private psychiatric hospitals with their baby and they have been taken care of. But again, the stigma even with the psychiatric hospitals. I think as healthcare and hospitals and management, as they watch this, they should know there's a place for that. And if a mother shows up in your hospital, whether it's a government hospital or a private, you should actually be able to help them, because you might shut them out and the next thing you see it on TV, a mother has killed a baby and killed themselves, and that would be the worst complications. We also know that untreated depression means that even the child's health is affected. This mother will not bond with the child, will not stimulate the child, might not even take the child for immunizations. And so we are losing two people. We are losing a mother and we are losing a child. And you know, if the background of a child, the initial things are not done well, the child will be affected even as an adult. So we need to be sensitive that we are dealing with two people. If we don't treat the mother, even the child is affected. And in cases of the father, having postpartum depression also, the whole family is affected. Everybody living in that house will not be happy. So it's good that we all become sensitive about it. It's good and thank you for this opportunity that the members of public, who even include hospital managers, can actually be able to create space for such situations.
Okay,
yes.
All right, thank you. So I'd like to just pick a few of your closing comments so that we wind up this very fruitful discussion. And I'll start with you, Samoina. Your closing comments on this discussion.
I'd love to let the moms know that struggling with postpartum depression doesn't mean that they're a bad mom or that they are failing at motherhood. It's a condition, like you said. We don't stigmatize people for having a cold, so we shouldn't stigmatize them for struggling with a mental health condition. And then the fact that, out of my experiences, I started a platform that offers support for moms with postpartum depression. We bring in a psychologist to offer group therapy for the moms. So we normally have a group of five moms or so, and we take them through therapy, because I realized there's a gap in there. So we offer support groups, and maybe they can get in touch if anyone feels they need that kind of a support.
Okay, thank you. Kendi, your closing comments?
Let mothers ask for help. Don't assume that you can do everything. And also those around the mother should always give support. And as she said, do not stigmatize a woman for the situation she's in at that moment. Yeah, and also they need to know that there are platforms where they can reach out to. So as she's mentioned, people need to reach out more and seek for help. Don't assume and think that people are going to treat you badly if you say you're going through postpartum depression.
Okay,
yes.
Thank you. And Dr. Ari, finally.
Yeah, I would say there is no health without mental health. So if you're visiting a mother who has delivered, as you ask them, is your episiotomy healed? Are you strong enough? Ask them, how do you feel? Are you okay? Can I help you with the chores? So that we also mind the mental health and the emotional health, as we also mind whether the wound is healed and whether the baby's cord is okay, and whether you've learned how to clean the baby, and whether your husband is happy enough. As we worry about all that, we should also care about people's emotional health.
Okay.
Yes.
Thank you very much. Thank you very much, ladies, for making time this evening to discuss this issue of postpartum depression. That's where we wind up this discussion. We've been talking about postpartum depression, how to cope with postpartum depression, the symptoms to identify as a mother or as people living with a new mother who's undergoing this mood disorder. And we've been discussing this with Somoina Wangoi, who is a mother of one, a 6-year-old, who's a postpartum depression survivor. We've also been talking to Purity Kendi, also a mother of one who's gone through postpartum depression, and obviously Dr. Siengo Mutisia, who's a consultant psychiatrist who's been explaining and helping us to understand what postpartum depression is. And we can continue with this discussion offline. You can tweet us at KTN News, or you can tweet me directly at Dr. Mercy Korir, or reach us through any of our lines so that we can continue this discussion. Until next Saturday, when we have another discussion on health, I'd like to wish you a very good evening and a blessed